Media Services Zoom News Conference, which we are presenting in partnership with the California Department of Aging. The topic of today's briefing is CalGrows, a remarkable online training program for California's vast population of caregivers who form the backbone of the healthcare system for older adults and people with disabilities living at home or in private nursing facilities. To support these caregivers, who include home health aides and certified nursing assistants, as well as unlicensed caregivers, husbands, wives, children, siblings, friends who voluntarily care for loved ones. The State Department of Aging has hundreds of free and paying online courses through its CalGrows training program. But time is running short. The courses end this September 30th. If caregivers enroll by August 31st, however, they may earn up to $6,000 to learn and use new skills. This briefing will explain the CalGrows classes, who qualifies for the stipends, how to enroll, and the skills that caregivers can learn. Speakers include trainers, caregivers, and clients. Connie Nakano, Assistant Director, Office of Communications, California Department of Aging, who will lead off our briefing. Lidia Mawalu, Fijian caregiver and CalGrows trainee in Monterey County. Corrina Rucka, elderly client of Lidia Mawalu and a former journalist. Carmen Contreras, CalGrows trainee, and Sean Hidalgo, classes manager at ACC Senior Services in Sacramento, also a CalGrows grantee. Speakers, we ask, speak slowly as I'm doing for our interpreters in Spanish, Mandarin, and Korean. Reporters, please enter questions in the chat. This topic touches all of us. Any question, however personal, drawn from our own experience, will be valuable to all of us. We will send a video of today's briefing along with expanded bios and contact information for each speaker to all participants later today. Our speakers are also encouraged to monitor the questions that are entered on the chat throughout the conference, and feel free to answer as you feel inspired to do. And now we begin with Connie Nakano. And I'm looking forward, Connie, to you providing an overview of CalGrows. Please go ahead.
Thank you very much, Sandy, for inviting us and that great introduction to CalGrows. So my name is Connie Nakano. I'm with the California Department of Aging. And to give you a little background on why a program like CalGrows is important. By the year 2030, there will be more than 10.8 million Californians over the age of 60, and this is going to create a significant demand for caregivers. Our ethnic communities are the heart and soul of California, and many of us are deeply involved in caring for our loved ones. As our population ages, the need for quality care within our communities grows stronger. And California is facing a shortage of up to 3.2 million caregivers. So training and development programs like CalGrows are very important to develop and support both paid caregivers and unpaid caregivers as well. A caregiver shortage can have serious consequences for both older adults who need care and the overall healthcare system. It can lead to longer wait time for services. It could lead to decreased quality of care and even social isolation for the older population. And CalGrows is important for caregivers by providing free training and financial incentives. We're empowering individuals to build fulfilling careers while providing exceptional care. You'll hear more from personal stories, like Sandy noted, from both Lidia, Corrina, and Carmen today. And CalGrows is really, it's more than just a training program. It's an investment in our community. By supporting caregivers, we're ensuring that our loved ones receive the care that they deserve. And by participating, you're not only advancing your career, but also making a positive impact on the lives of countless individuals in our community. CalGrows is a program. We have over 600 courses, and they're available in 9 languages. To date, we have approximately 14,000 caregivers that have already participated, taken 89,000 courses, and we've given about 7 million in incentives for taking these courses. And time is running out, like Sandy noted. All our courses are available until the end of September. However, the financial incentives end August 31st. So we really encourage all caregivers to take advantage of the CalGrows program. So Sandy, now I'll turn it over to you and we can hear from the others.
Well, there are a couple of questions. And first of all, Connie, how long during the day, if you sign on to these courses, this may be something that Sean Hidalgo will address, but how long a time period would a course involve on a daily basis? Do you sign up for a course and then have 5 days in a row with a couple of hours a day? Or just could you give us some sense of the time commitment being a trainee involves?
Yeah, that's a great question, Sandy. And that's the beauty of the CalGrows program, is that there's over 600 courses and they all range from varying lengths. From some can be 5 minutes long, some can be 5 hours long, some can be part of a series. So to get more information, you can go onto the CalGrows website. It's calgrows.org. And there you can see all of the courses that are available, and you can set filters too. If you want to look for in-person courses, you want to look for a live online course, or you want to look for a self-paced course as well. Many different topics to choose from, where, you can learn CPR, you can learn, how do you care for somebody with dementia, or, overall care. You can learn about, mental health in older adults. So a lot of different courses that you can select through. And, that's the great thing, is that there's over 600 courses, and they're also available in 9 different languages. So you can kind of pick and choose to how it works with your schedule and what you want to learn.
That's very helpful. We have a question from Sunita Sarabji, our health editor. Sunita, please ask your question.
Hi, Connie. Is the aim of the program to allow people to remain in their homes rather than in assisted living facilities? And how does this program fit into California's Master Plan on Aging?
This program allows people to be able to have the options to choose, right? If so, caregivers, it's not just one-dimensional where it's only within a nursing facility, or it's only in home. There's caregivers for a lot of different aspects of how people choose to age. So that's the purpose of the program, is to make sure that we're training caregivers so that there is this diverse opportunity, or diverse selection of caregivers, so that somebody does have the ability to choose how they'd like to age in place, and that that support system will be there for what they choose.
I have a question in my personal chat, asking, where are you seeing the biggest demand for online services? Are you seeing it from professional caregivers? Are you seeing it from family caregivers? friends, family members who are unpaid. Do you have a sense of where the demand is greatest?
I'd say the demand for the program has been pretty equal overall, and it's been very well received from both paid and unpaid caregivers, where both sectors have been participating in it. So I don't think there's one specifically that we would highlight that we noticed saying that there's more of this than that.
And a follow-up question is, as the number of older adults has increased, are we seeing a similar increase in the number of people with disabilities, in the population of people with disabilities in California who do require some form of care?
I think that, I don't have the exact numbers to that, but naturally, you would make that assumption to where if the number is increasing with older adults, and older adults naturally, may acquire a disability as they get older. So that number you would think would increase, but I don't have those exact numbers.
Right. We can perhaps, it occurs to me that we had those numbers at one point and we'll try to get them. It's important because we often think of older adults, and then we've learned through working with the Department of Aging that as people age, so does the likelihood of their becoming people with disabilities. So it's a continuum of caregiving needs. We have a question from Araceli Martinez. And Araceli, please ask your question.
Thank you and good morning. I was wondering if this program is free of cost, or how much do we need to pay? And is this open to everybody, including undocumented immigrants? And once, let's say if I take one of these courses, what can I expect in terms of job opportunities? Thank you.
So this program is completely free, so you don't have to pay for any of the courses. And there are different requirements for the paid and unpaid caregivers in terms of who qualifies for the stipend. So if you go to the website, the calgrows.org, depending if you're paid or unpaid, there's different prompts and different things that you would do in terms of registration. So I would advise going through that to find out what the individual would qualify for. But the program is indeed, everything is free, so you don't have to pay anything.
And in terms of undocumented status, that is not an impediment to qualifying for enrolling, correct?
For the paid incentives, you have to be a paid caregiver. So I would defer again going to that CalGrows website and seeing what the qualifications are in terms of a paid caregiver, because there's certain qualifications that you have to meet in order to get the paid incentives. Otherwise, unpaid caregivers, all the courses are free, and there's courses online as well that you can register for.
But my question is those courses that are not paid, if I'm an undocumented immigrant taking care of my mother, let's say, or a neighbor who is an elder, can I have access to this training, or I have to be a resident or a U.S. citizen?
It depends on the course. If you log on the website, there are some courses that are automatically online that you don't have to register, and you can just click and you can view, and you'll get the information on there. So it varies by course, but I would say go to the website and you can learn more and see which ones are available online that you don't have to register for.
Thank you.
Mm-hmm.
Those are excellent questions. I think the final point I want to make before we go to our next speaker is that Lorena Dominguez works for the Department of Aging and can also provide Spanish language follow-up interviews. Lorena, do you want to introduce yourself?
Yes, thank you, Sandy, and good morning. Yes, anybody who has any questions or want to request an interview in Spanish, I'm happy to help. Con mucho gusto les puedo ayudar a cualquier pregunta que tengan en español. Gracias.
I'm so sorry I have a coughing fit, so I don't want to let that slow us down. I do want to go to our next speaker, and thank you so much, Connie, for your overview. So Lidia Mawalu is our next speaker, who is a Fijian caregiver and CalGrows trainee, now working in Monterey County. Forgive my cough-inspired introduction. And Lidia, please tell us about your experience with the CalGrows training program. You're on mute. You need to unmute.
All right.
Great. Thank you.
Okay. My name's Lidia Mawalu, and I work as a caregiver here with Corrina Rucka. My experience with the CalGrows was really excellent, fantastic, and I would recommend to other people that have seniors around them or have seniors in the family to encourage your caregivers to look into these online courses. For me as a caregiver, it is a wealth of knowledge, gave me a tool and knowledge of how to take care of seniors that I'm allowed to cross my path. And it's, I would put it, it's like we work with a person either at a home or in the individual residence. And this knowledge that I've learned from CalGrows through Stanford was knowing exactly medically what's actually happening inside the person. And it enhances and helps me understand what that senior person is going through in their daily life. Hearing all the classes that we got through was, for instance, with medication, if you get to administer medication or as they rise up during the day, how the body works and helps me understand, okay, this is what she needs. This is what I need to do, preventive care in order for that person not to fall, Different people, different clients take it differently. It's for me as a care person to be proactive and anticipating, how to make their life an enjoyable one, waking up and words that I use to inspire to them. Okay, this is another beautiful day that you and I are going to work with to get through to the end of the day. And the knowledge that CalGrows has given through Stanford was phenomenal. I would say, I would encourage us, take the time, sacrifices to get to know more about what's given out there for us. For me, if it wasn't for Ultimate Home Care in Palo Alto and Stanford, reaching out and saying, hey, Lidia, would you want to, try this? And I said, why not? I asked Corrina, she's very inspired. I said, yes, go ahead. So the Zoom classes and also the appearing there once in person for practical and then the classroom learning, it actually made me love this kind of work, aging, Like one of my previous clients that has passed on, she used to remind me, Lidia, she was a lady from Germany, do not grow old. And I used to say, okay, is there any other way out of old age? It was her funny way of telling me, let's keep going. let's keep moving forward and staying positive. And this course has really helped me a lot in the knowledge and the tool to keep loving this work of taking care of our elderly citizens out here in America. I can't hear.
There is, among many people seeking help with caregiving, a tremendous reputation for people from the Pacific Islands as caregivers. And that, of course, includes people from Fiji. What is it about coming from Fiji and the Pacific Islands that makes you such exceptional caregivers? And to what extent would you say that the Pacific Island caregiving community needs to know about these online training classes that can help you even build on the skills you already have?
Right. Thank you, Sandy. Yes, back at home in Fiji, as we grow up, we're an extended family. So with us, as we grow up, we fit into our schooling days and weekend days, taking care of elderly people around us. Either you live in the city or in the villages. So it's an inbuilt thing in us, in our culture also, that as our aging population ages, we bring them home to us. And the time given to them is so precious until their end of life. So it's an inbuilt thing in us. And things are unlike Fiji time, which I had to, most of us had to remind each other, we're in America, it's no Fiji time, it's American time. So if there's a Fijian person coming, they have the understanding, okay, it's a laxed way of taking care of people around us. And the biggest breakthrough that we have in our culture is the smiles. You might hear the word bula. Bula in our language means life. So it's kind of like we're calling life across you. And my lady here would agree to me, like in the morning I walk in, I say, Corey, bula. And she returns telling me, bula, bula. Like, yes, Lydia, life, life. So as we move over to an overseas country, this kind of courses is actually needed, and a word has to be spread out to our people coming here. There is courses available. To not be scared. The thing is, when we come over, there is a little fear, like, oh no, I can't do this because, maybe because of status or because of other things, but it needs to be encouraged. It's available there. Come in and, sit down and learn and take as much as you can so you can take care of seniors around you.
So you would say this has definitely increased your confidence about your work as a caregiver.
Exactly, Sandy.
Right.
Yes, that confidence needs to be built, because as you see one and you hear, oh, they're from Fiji, they will give you the smile, but, it's just a word to encourage, hey, you can do it. That's what we always say. The smile is a doorway in there, and then you can learn. Like I do, I would say, Sandy and Connie, after the class, the graduation from Stanford, it's inspired me. I've had emails and text messages, Lydia, how do we do this? Can we join? And I said, yes, we can. And after hearing you and Sam and Connie explain, I would definitely spread the word by mouth for them to get into these classes. It's available. And I can also, guide them along.
Okay.
Some of them may not be computer savvy, but it's doable. We can always teach them whatever to have, how to do stuff.
Okay, thank you. I want to go now to Ms. Rucka and ask you, did you feel a change or a difference with your caregiver after she became a trainee? What would you say the impact of the training was for your already very excellent caregiver?
Well, she has always been, as long as I've known her, very, very helpful and aware and an excellent helper. She's, she's a very unusual person.
What would you say are some of the things she learned from the training that you've noticed in the care she provides? And forgive me, Lidia, for referring to you as she. Lidia.
Yeah.
I have to think about that because I just assume the way she is, that she knows how to do these things. And she's very, very aware of what's going on around her and very aware of how the client is feeling.
That is such an important point, because when we asked Lidia, she said, the training helps me understand the patients I work with and listen to them. So it was not just a skill I acquired, it was a way of communicating and hearing better what the patient needed.
Yes.
So are you learning some words in Fiji beyond bula bula?
I think bula bula is about as far as I've gotten.
And what would it be like if you didn't have Lidia greeting you in the morning with bula?
It would be very difficult because as soon as I wake up, she's there and she's asking me if I need anything. And she's excellent. She keeps an eye out for my needs and helps me. I seem to be losing my voice.
Well, yeah, I hope you didn't catch it from me. When you get a coughing spasm, it's hard to express. One last question for you. In terms of the challenges of being an older adult and an older adult with inevitable disabilities, how important are these training programs for caregivers? What would you say as being someone who's on the receiving end or in need of this kind of care?
Well, I would say that someone like Lidia is very aware of the client's needs, and she'll ask, "Are you feeling all right today? What shall we do?" And she'll suggest various things depending on the day and what's going on.
So keeping a sense of a positive outlook, Lidia, how you feel, how optimistic you are about the day communicates itself to your client. I don't like to say client because in a way you are now almost a family member.
That's true.
How do you keep your sense of optimism even when there are serious health challenges?
With the words that I use, it's very particular that the person that you're taking care of. And the first thing that I do is put myself in their shoes. because some of the diagnoses that clients go through, they did not ask for it. Some are genetic, some they're still trying to find out, like if a strong willpower person like Corey will still asking, why is this? Why, the why question. So being a good caregiver with the material and the lessons that I've learned from the CalGrows with Stanford is understanding internally, medically, what's actually going on up there.
Yes.
And as I put myself in their shoes, it helps me use the right word on the level that the client can understand. Because if not, it'll be like their facial expression will tell you if it's a good day, or it was a bad dream, or they're scared. What am I doing today? Is there a doctor's appointment? What did the doctor ask? So I stand in there being her eyes and her voice, and create that atmosphere that they will enjoy the day, that it'll be okay, reassuring them, it's a matter of going through the process, it will be okay, eating the right food, taking your medication, drinking your water. That's one thing we remind each other. Have you drank your water, Lydia? Oh, I haven't. Get on, drink your water. I'm drinking mine. So we've had a mutual relationship, knowing, helping her go through life, until the Lord calls us home. So it's a very compassionate and a very loving, I would say, work. Once you know what you're doing and you understand your client, and you'd love to continue and share it with the others, that it's an enjoyable task.
Thank you. Thank you. We will come back to you with a final question, but thank you so much to both of you for sharing an intimate experience, very important intimate experiences in both your lives. And the role CalGrows training enhances your capacity to communicate, I would say, with each other, which is key to the healthcare providing. We next go to Carmen Contreras, who is also a CalGrows trainee, whom we've asked to share experiences for how this program has helped her care for patients in the Latino community. Ms. Contreras, thank you so much for joining us. We're eager to know what you thought of what Lydia shared with her colleague, and what you took away from the CalGrows training.
Well, good morning. She was spot on. She has everything right, because the patient is most of the time afraid, new to the illness that they may be experiencing, and they just need to know that there's somebody there that's going to be able to help them and guide them and know what it is that they need in order for them to succeed, recuperate, and have the best quality of life that they can. If it's, as for me, it was my father recently having a stroke, and just having to go through it with him and seeing how now he depends on me a little more, as to vice versa, me always depending on him, and the relationship that we built, and how strong and how he recovered with the care that all of his family members have given him. I would say he's about 90% recovered, and it's a joy, because we always think that everyone always goes to the doctor or knows everything that's going on with them. And sometimes these specialty doctors they don't understand, and not knowing the language always is a scary thing for them. And having someone there with them to explain to them step by step everything that we need to do, I feel that it works wonders for the patient. I'm able to explain to him, he's able to ask me, I'm able to ask the doctor, so that there's no doubt that he knows what is expected of him in recuperating and all the things that we need to do moving forward. It's an adjustment, no doubt, but it's very doable.
How much time did you spend doing the trainings? And did you sort of carve out special times during the day? Did you have to be on the class at specific times? And if so, could you give us some sense of what the time requirements are for taking the courses? And how did you select the courses you took?
The courses that I took is the HHA, the home health aid, and that is a requirement of 40 hours. And they have the times already set for you. You do so much of it online, the rest in person, and then you do your presentation. They also have available the CNA, which you physically go into a school, and that is 160 hours of your time. 10 days are online, and then the last 4 weeks are in person. You go into a facility, they teach you all the skills that you need in order to be able to go into a facility and assist a patient with bathing, with dressing, with activities, their daily life. So
Had you been, before your father had the stroke, had you been involved with caregiving? Had you been a professional caregiver?
yes, I had been in the past, but it was something that I really truly needed to brush up on. Yes.
And where do you see the training you had? And I think this was a question from Ms. Martinez at La Opinion. How do you see it essentially advancing your career as a caregiver?
Well, the school and the program give you the first initial steps as to seeing what it is that you can possibly do in the medical field, because now you're working in a hospital, you're working with different hospitals, and you can see, okay, maybe I'm a CNA now, an HHA, and you like radiology. It opens up many different avenues. I can become a phlebotomist. You start to ask those types of people, and it carries on, and you can see what it is that you do. Those are the building blocks to whatever it is that you need. But because of all the requirements that you need to move forward, your basis is your CNA and your HHA. So you've already have the fundamentals to what it is that you need to do for anything medical, because those are requirements of your LVN programs, of your RN programs. A lot of them require it, and some of them strongly require it. So it's just a building block to that.
And did each of you, Lidia and Carmen, receive certificates when you graduated? Are these things you could show in the future? Are they certificates that carry weight in your field?
I can answer first. Yes, you have a certificate of completion, and you become a certified CNA or an HHA, and that is a certificate that you will renew every 2 years with continuing education units. If you're a CNA, it is 48 every 2 years. And if you are an HHA, which is what I am, an HHA and a CNA. You have another 26 on top of that with continuing education units. So you are certified.
So this really is a career path.
That is correct. It's a career path, and it makes a big, huge difference in, I mean, I see it on a daily basis with my classmates on to see how it is that it's changed them and what it is that they can do now.
Right. Thank you so much. Lidia, you received a graduation certificate, and we've heard from other programs like Self-Help for the Elderly. This work has never been recognized by some of the trainees, and for the first time, they feel that it's gained legitimation and a validation getting the certificates. Would you agree with that? Sorry, you're on mute again.
Mute. All right. Can
Yes.
you hear me?
Yes.
Okay, Sandy. Yes, I agree with her, what she had said totally. The course, the CalGrows course with Stanford, gave the pathway that, I can continue with areas covering in the medical field and taking care of seniors. Because as we started work here, things that we do at the house, like we take blood sugar, medication, getting the medication ready, giving the client the medication. Some of us do catheter, how to clean a catheter, all these. Through these CalGrows classes online, I was looking through it and it gave a lot, it covered. So the classes that we go online certifies us into the practical things that we do in the home with the clients. And when I have respite care to come and relieve me when I take a break, I teach them that because I have the notes with me and also a way they ask me questions. So it encourages another respite care person and they ask, how did you know how to? So I refer them. I can always say, hey, go through this online thing with CalGrows. They have classes there. You can do it. And it actually helps me see that it's not just these classes. There's more offered by CalGrows. There's more out there to learn and get certified in. And,
Great.
Corey would agree sometimes when I'm on an airplane, when we fly to Portland or fly to see her sons, I'm always ready. I have this love for seniors that once the flight got delayed, couldn't land in Monterey because of some weather condition. We had to divert to Fresno. And I had 3 senior people who got so scared and said, oh, our medicine and all this. So I stepped in, and asking them, when is your medication? You have your notes, helping them out, charging their phones. These are the areas we as care people, like I would say, first.
Right.
First.
Sorry, because we're running out of time, but I think you made a very powerful example of how this gives you a certificate of not only having learned, but of being appreciated for the skills you provide. So we now go to our final speaker, Sean Hidalgo, who is the manager of classes at ACC Senior Services in Sacramento, and will also talk about the skills that caregivers can learn, the deadlines for enrolling in the program, and all the kind of nuts and bolts we may not have covered. Thank you, Sean, for joining us. You are also a CalGrows grantee, your program. Thank you so much for joining us.
Thank you. Good morning, everyone. Thank you for that introduction, Sandy. Thank you, everyone else, for sharing as well. Just again, I'm Sean Hidalgo. I am the classes manager at ACC Senior Services. We're a community center here in Sacramento. So we are one of the host agencies for the CalGrows program where I help people sign up and register for classes. We have also hosted a couple classes here as well as a couple online. And I also, as Sandy mentioned, I am also a grantee, so I've taken a couple classes as a direct care worker. And it's just really been beneficial just working in a community setting, getting those skills and knowledge just to help the overall community and just noticing little bits of pieces and knowledge for all the older adults here at the community center. And so I know Sandy mentioned, just to mention some stuff about deadlines and anything that might have not been mentioned earlier. So it is kind of getting close. So the deadline for the last class is actually the end of the month of August to actually take a class. So you have until the end of the month, and then to kind of submit a claim, you have the rest of August to the end of September to kind of fill out those claims to receive incentives. But as mentioned earlier too, if you're not looking for incentives, I believe some of the classes, depending on who is their organizations, will still be up and you'll be able to still take some of those free classes.
Could you tell us what specific skills were most valuable to you in terms of the training you received?
Yes, of course. Great question. So some of the courses, the great thing about CalGrows is there's a wide variety of courses ranging from dementia, cancer care to even just management and like dietary and mental health. So some of the things that really stuck to me working in a community setting was kind of this one class called Process of Aging to really learn the different processes of aging, because not everyone ages the same. And kind of just realizing these different signs and symptoms, not really symptoms, but yeah, signs and tells of when someone is reaching a certain stage of their life. And working in a community setting, it really helps to kind of understand that, kind of be more knowledgeable and what's the word? Empathetic to the seniors, kind of understanding the situations and recognizing those signs. And another one that really stuck out is just some dietary, healthy living choices that I could kind of talk to just around my seniors and older adults here to mention some like healthy options that they could do and just really help the community and the center, make better choices and really offer that to the community.
How did you get the word out about the classes that were available through your center in Sacramento, the ACC Senior Services? How did people come to know? And have you seen an ongoing demand for this CalGrows program?
Yes, definitely. We've actually just recently got a huge influx of people signing up. It's just been kind of wild to me just because I'm the one signing everyone up, and suddenly everyone is registering for classes, which is great. We've reached out to a lot of our communities. We've done a couple presentations in person to some other facility sites, other community centers, and we've also created a couple flyers that are in different languages as well and distribute them just around the city, so anyone who is eligible could take the classes.
Thank you. I guess a very important question for many of us is if a relative, if your husband, if your wife, if your father or mother, as in the case of Carmen Contreras' father having a stroke, if you are suddenly confronted with the need to acquire skills quickly, how quickly can you enroll? And now that there is a deadline, would you still be able to enroll in these classes before the end of August and still be available to take the classes in September? I think the Department of Aging is so anxious to make sure whoever would be interested knows these classes exist. So that's why, late as it is, with the clock running out, we wanted to do today's briefing to give a chance at those of us who would really benefit from the classes would know about them?
Great question. Yes, so just to kind of dive into it, yeah, these classes, the great thing about it, they are really simple to register, but it really depends on the organization who is hosting the class. So I can't speak for everyone or the other classes that are listed, but for ACC, the classes that we are hosting, it'll be available still after the August and September classes, the ones that we specifically host. So but those ones are, we have live classes that people could join in person, or we live stream those as well. And usually for the case, we also, depending on the presenter, we record them and post them on our YouTube and social media channels so anyone could get access to that. We use an online training platform called Relias, but unfortunately, that one will not be available to everyone after the CalGrows program has ended, just because of the cost and how much staff time that it uses to register everyone for that. But for all the other classes, it really just depends on the organizations who are hosting it.
Okay, I want to ask Connie to follow up with the clarification you've underscored in the chat. There is a question about what it means to file a claim. Do you mean that if you want to apply for a $6,000 stipend for participating in training, you need to file that application by August 31st? Or could you clarify that?
Yeah, thanks for bringing that up, Sandy. Yeah, for clarification, so paid caregivers can earn up to $6,000 in incentives. And you'll need to go through the registration to see if you qualify as the paid caregiver or as a paid caregiver. There's different qualifications. Classes need to be taken and the claim form needs to be submitted by August 31st if you'd like to apply for that paid incentive. The courses are available online until September 30th. But if you want to be paid, you want to be to get part of that paid incentive, you must have taken the courses and applied by August 31st.
What if you are at home and unable to participate in person on an on-site training and can only participate in online training because you have extensive caregiving duties at home?
There's online classes as well, and that's the beauty with the over 600 courses. You can select what works for you, whether it's in person or a live, a virtual, or even one that's a self-paced online course that you can take when it works for you.
And why is there a need to end this remarkable program? Because it just seems as if the demand for these kind of online classes is only going to grow. Is there a possibility that CalGrows can be renewed? Was this federal funding, or is it possible that there could also be state funding for this program?
The program is tied to funding that is expiring. But what we really want people to know is take advantage of the program now and the opportunity that we have here for caregivers to take the courses, and there's the ability to apply for the stipends until August 31st. And then for the unpaid, or for all caregivers, if you're not applying for the stipend, that the courses are available still through the end of September.
I think we're coming to the end of the hour when we ask all of our speakers for a sound bite, a 30 or 60-second, no longer a summary question. And in some ways, I think one of the most important themes we've heard from our speakers is just the enormous rewards that come from this work, and that the work succeeds to the extent that the caregiver is able to have a profound communication with the patient or client. I'm not sure what the best term is. So I'm going to start with Connie and say, what is the headline that we as ethnic media need to give? Time is running out for this important question, for this important training program. What is your best headline, Connie, for us to take away? And then I'm going to ask each of our speakers for their final summation.
I'd have to piggyback on your same headline, Sandy, is that time is of the essence and time is running out for the program. There is still time for someone to participate, but we really encourage folks to really jump on this opportunity. We have a couple weeks left in August for paid caregivers to take advantage of the incentives that they may be able to partake in. And we really encourage, all paid and unpaid caregivers to come to the website and take courses and see what fits their needs in terms of what they'd like to learn.
That's terrific. Lidia, what would your headline be to encourage people to take CalGrows training? Why? What is the most important thing you could say if you only had one sentence?
I would say, together we can do it.
That's a wonderful, that's as powerful as bula, bula, bula.
Bula bula.
It's a joint commitment of the caregiver to the person being cared for and the patient to the caregiver. Thank you. And Corrina, I'm not sure you were, as you know, as a journalist, headlines are tremendously challenging. What is your headline for why people should take the training courses of CalGrows?
Well, I think the courses are very valuable to your knowledge, to your ability to help, to do things. And I think that whatever you do, you should take these classes when you have time and go to the basics and know how to do it.
Thank you. And coming from somebody who is dependent on effective caregiving, that's the most powerful testimonial we can have. Carmen, what is your headline for the media, especially Spanish language media? If you want to give it in Spanish, that's fine too.
The skills that I've learned will help and touch many lives, and I'm ever grateful for that.
That's a great testimonial. Thank you. And you have the last word, Sean Hidalgo. Thank you so much for joining us. What do you want to say in a single sentence that you'd like to see in a headline?
Yes, thank you. I would just say that CalGrows, what stood out to me the most is just how flexible and accessible these classes are, especially for caregivers and direct care workers, is the amount of information and skills you can learn. And even the best part, just being able to get incentives for it. You're basically getting paid to learn, and then you're able to become better care workers and caregivers because of it, and to be able to serve the community all for free in these accessible and flexible classes.
Well, that's a great summary. It's a little long for a headline, but it is definitely a great testimonial. I want to thank the Department of Aging for giving us this, and it shouldn't be the last. I think if anything, we should advocate for more of these
Yes.
training programs,
Yes.
not to end the end of
Agree.
or the end of September, but to become an integral part of what the mission of the Department of Aging is, a master plan for fuller lives for people as we all inevitably age. Thank you so much
Thank
to
you.
our
Thank
wonderful
you, Sandy.
caregivers.
Thank you.
Thank you, Connie.
Thank you,
to-
Connie.
Thank you.
Thank you.
Okay, thank you.
Thank you.
Very inspiring hour. Thank you so much.
Thank you.